Hi, so I'm going to perform my cardiac exam again on my patient, Jennifer. And for the purpose of this video, we don't have an actual space for her to actually lay down currently. However, we're going to pretend and I'll try to hit those points. So my patient here is sitting here and I want to look at her jugular vein. And I'm going to do my assessment on the right side. However, I will take a peek on the left. I'm going to measure the jugular vein, and a lot of the times physicians use that or providers use that assessment technique to measure fluid overload or a condition that shows that there might be some sort of engorgement or distension there, or whether or not the patient is like a euvolemic or something to that sort. So a nice way to measure the auscultation here is by having a card, like an index card here at the pulsation with a ruler at the sternal angle here, and then you'll be able to measure the centimeters that way. So when she has a normal JVP pressure, I'm now going to assess her carotid pulse. And by doing that, I am going to palpate her carotid pulse, which I feel it here. And I don't notice any thrills or anything of that sort. She has a normal pulse, carotid pulse there. And I'm going to now auscultate the pulse. And I'm going to be measuring amplitude of the pulse. It sounds good. I don't notice any breeze or anything on that pulse, and everything is intact there. So after assessing my patient's carotid pulse, I'm going to now assess my patient's chest area, just so I can see if there's any tenderness there. Any tenderness?
No tenderness.
I'm palpating, especially with my fingertips, the pads of my finger, to see if I feel any crepitus above the skin, under the skin, scapular tissue. I don't feel any crepitus. I don't feel any heaves. I don't feel any thrills, any tenderness there. There's a normal assessment there. As I'm here, I'm going to feel the PMI, the pulse, maximum pulse impulse here. And it's here at the 4th and 5th intercostal space. It has a short duration in a soft, gentle tapping is what I assess here at the 4th and 5th intercostal space of the PMI. So after I've located the location and I discussed the amplitude and the duration of that PMI area, I am now going to auscultate my heart sounds. And a normal heart sound is a S1 and S2. And normally with those heartbeats, you'll know that at the apex of the heart, the S1 is greater than S2, and at the base of the heart, S2 is greater than S1. So as I'm auscultating the heart sound, there's a sequence to go to. And the adequate sequence starts with the aorta. It's here at the right side of the chest wall. And it's in the 2nd intercostal space. And I'm going to do the same thing at the pulmonic here, which is at the 2nd intercostal space on the left side. And then we're going to go down to Erb's point, which is at the 3rd intercostal space. I'm still hearing that S1, S2. And then at the tricuspid, which is at the 4th intercostal space, 4th and 5th. And then the mitral, which is more so on the left side here on the 5th intercostal space. And I hear that S1, S2, and I don't hear any murmurs or anything like that. While we're in the subject of hearing for murmurs, a good way to hear for aortic regurgitation murmurs is by having the patient sit up. I'm going to have her lean forward. And as I'm listening to her heartbeat here, I'm going to have the patient inhale. Exhale completely. Excellent. And hold your breath. I don't notice any type of murmur there. I'm going to also assess for a mitral stenosis area of a possible murmur there. And the best way to assess for that mitral stenosis is by having the patient lay flat to her side in a lateral position. And I'm going to assess for that murmur here. In that lateral decubitus position, I don't hear any murmurs there. So after my cardiac assessment, hearing great normal heartbeats, I'm going to now assess my patient's peripheral vascular system. And by doing that is, the first thing you want to do is look at the patient's arms. There's a head to toe here. So we're going to look at the patient's arms. I'm looking at her skin. I'm looking at skin tuger. I'm looking at the hair distribution, noting color. I'm looking at her capillary refill, which is less than 2 seconds. There's no clubbing, there's no cyanosis or anything of that sort. And I'm going to now feel for her radial pulse. And a normal pulse is 2+. 2+ brisk pulse. This is a radial pulse, and the same thing with the left side of her hand, which is the ulnar pulse. And I can feel that. And you will do the same thing with the alternate arm. The brachial pulse, which is right here, right by the AC on the left inner arm here. I could also feel that. If you want to go more into deep here, you can also feel the brachial pulse right here in between that groove right there. All her pulses are 2+. Okay, and as I'm on this subject here, on this area here, I'm going to assess her lymph nodes. The epitrochlear lymph nodes here. It's kind of hard to feel that right under here. It's kind of hard to find that lymph nodes here, and then go down and feel the axillary lymph nodes as well. We don't notice any enlargement, anything that feels abnormal with her lymph nodes or anything like that, no tenderness. So as I'm assessing the patient's pulses and stuff, arteries, right? Arteries. I'm going to now assess the patient's, there's a special test that can test occlusion, and this is the Allen test. So the way I'm going to do that is have the patient make a fist, and I'm going to occlude her radial and her ulnar pulse. And as she's making the fist and she's holding on tightly, I'm going to remove the pulse, the pressure on the pulse that's occluded, which is a radial. And I'm going to have her open her hand, and then you'll see the flushing come back on the radial. And you do the same thing when you're assessing the ulnar pulse. So after I've done my upper extremities, I've done and checked all my pulses, I am now going to perform a aortal assessment, which is we're going to do it on the abdomen, have the patient lay flat. And I'm just kind of measuring the patient's aorta by going to one side of the right side of the abdomen here and having my fingers like this so I can feel the size of the aorta here. And then to measure it, we do that with the other side in between my fingers. And then that way I'll be able to measure the span of the aorta. And I want to auscultate also. I'm going to auscultate the arteries there. We have the aortic artery here. And I don't notice any bruits or anything like that. And then the renal arteries. No bruits or any abnormalities there. And then the femoral, which is on the lower part of the abdomen here, from side to side. I don't hear any abnormal bruits there. So as I'm already assessing my patient's abdominal area, just a positioning again, I'm going to palpate the inguinal area, the inguinal lymph nodes, which is like pretty much around my area right here. So I'm going to assess them for any tenderness, any enlargement, any tenderness there. I'm testing size. I'm testing if there's the mobility. And I'm looking from side to side to make sure that there's no abnormalities there in her inguinal nodes here. And it all feels fine. So I'm going to now perform my assessment of the, can you hold this right? Of the legs. The same thing that we were doing with the arms. Before I place it here. Hold on one second. I apologize for the positioning. How do you turn it? Okay, so here I'm looking at the patient's feet and skin. The same thing with the hair distribution. I'm noticing to see if there's any swelling, any varicose veins, or anything that might look abnormal. I'm just feeling the skin to look at the temperature. I'm doing my assessment and seeing if there's any abnormalities there. So I'm going to start with my pulses here. This is the dorsalis pulse. It's a 2+. And then the tibial pulse is right here. Same thing here. Okay. That feels fine. And then the popliteal pulse is right underneath here. Right here. You have this one is kind of hard to feel, but if you palpate it deeply, you should be able to feel it, as I'm feeling right now. That feels fine. So the popliteal pulse is there. I don't feel any edema there, any swelling. There's no pitting edema, nothing there. So pretty much my patient has a negative peripheral vascular assessment as well. And her heart sounded well, but that's pretty much the gist of the cardiac assessment in the peripheral vascular system. Thank you.